Doctor, you found this patient was suffering from meningitis? That is correct, meningitis. And what is meningitis? Meningitis is one of the most serious sequelae of ear infections. Doctor, should it be acute or chronic suppurative? Well, it is usually suppurative, but it is usually suppurative otitis media, which may be allowed by intracranial complications. What are those complications, doctor? Those complications are thrombophlebitis of the lateral sinus, extra or intradural abscess, labyrinthitis, facial paralysis, and others. Doctor, is it in children or adults usually? It is in adults because of the intimate relation of the middle ear to the middle cranial fossa in early life. What is the symptomatology, doctor, which may develop? Yes, it may develop slowly or rapidly. It may develop slowly, or there may be an abrupt onset of her disease without prodromal manifestations. Is there a chill involved? Yes, a chill occasionally signals the beginning of the acute phase. Doctor, what about the cerebral invasion of pathogenic organisms? Well, with the cerebral invasion of pathogenic organisms, the cardinal symptom makes the point of being excruciating, and in addition, there is vertigo, there is syncope, particularly in the absence of labyrinthine involvement. As the disease progresses, prostration increases, convulsions occur, particularly in children, and maniacal attacks in extreme cases are present. Doctor, in infants, the large fontanelle is bulging, is it? Yes, it is bulging, but there is no string muscles when the Koenig sign is positive. And that is evidence of what, doctor? That is evidence of pain and reflex contraction in the hamstring muscles when the examiner attempts to extend the leg after flexing the thigh upon the body. And doctor, is there muscular rigidity? Yes, there is. Of what? Of the back and neck, and retraction of the head are characteristic manifestations. And doctor, in addition, the patient suffers from photophobia, yes, as well as hyperesthesia at touch, and epistotonus. If treatment remains ineffectual, progressive drowsiness and coma develop, and the deep reflexes disappear. The prognosis is, to say the least, poor. Doctor, spinal fluid findings clinch the diagnosis, is that correct? Yes, they clinch the diagnosis. What about the fluid? The fluid appears cloudy and purulent, and the pressure is increased. Doctor, the cell count is high in lymphocytes and polymorphonuclear leukocytes. Is that correct? That is correct, especially with respect to polymorphonucleates. The protein content of the spinal cord is what? It is markedly rises while the sugar drops. An excessively high protein is usually associated with ventricular blockage and signals a fatal outcome, doctor? Well, I would say that the smear and culture findings generally indicate that the bacterial invaders causing the ear defect are the same as those of the otogenic complication in the brain. Doctor, the Streptococcus pyogenes and Diplococcus pneumoniae are the common etiological agents of diffuse purulent meningitis? Yes, it is. While Neisseria meningitis is a very pyogenic diplococcus and provokes epidemic cerebrospinal meningitis. Doctor, what is the best treatment? The best treatment is prophylactic. Is that antibiotic therapy? Yes, and the establishment of adequate drainage of the suppurative focus in the ear, which have lowered the incidence of otitic meningitis within the last 2 decades. Doctor, once the disease has developed, is there vigorous treatment called for? It must be instituted to combat the infection, prevent ventricular blocking, and maintain electrolytic balance and nutrition. Good.